Welcome, honorable attendees of the second Global COVID-19 Summit. Today, I'm going to tell you a story of our current moment in the global race to immunize against COVID. In 3 minutes, we're going to look at how inequitable access to vaccines endangers our progress, and I'm going to make recommendations for a legislative solution that should be promptly implemented. Global progress to vaccinate the world looks promising in the aggregate. To date, just over 2/3 of the entire global adult population have received at least one dose of a COVID vaccine. However, if we dig a bit deeper, the picture isn't as rosy, and we see that vaccine equity is a pressing challenge, threatening to derail our progress. Vaccination progress is dramatically unequal. Currently, low-income countries, especially African nations, have significantly worse overall vaccine coverage than the rest of the globe. This map shows the percentage of each country's population that is fully vaccinated. We see in orange the countries with the lowest levels of vaccine coverage. A country's income status is directly associated with improved vaccine coverage. This chart visualizes each nation as a single dot, placed relative to the percentage of its total population that is fully vaccinated. We see that low-income countries significantly lag behind wealthier nations in meeting global targets. To date, all but 2 low-income nations have been able to meet the base coverage target set by WHO. A limited supply of vaccine doses made available from proprietary developers inflates vaccine price. Low-income nations are unable to compete with wealthier countries in the global marketplace. A proven strategy to lower drug prices is for legislatures to waive patent rights, allowing for open production of the biomedical tools. We can look at a previous success with HIV. This visual plots the price per dose UNICEF negotiated for life-saving ARV medications. Up until 2016, the rights to produce the most common ARV drug were held by a single developer who were charging UNICEF an average of $29 per dose. Patent restrictions were lifted, and by 2017, generic versions of the exact same formula entered the market. The immediate increase in supply dropped the price per dose of this drug by 96%. At scale, this amounted to massive cost savings UNICEF was able to direct towards other efforts to improve health. The same strategy could be successful with COVID. On the left, we see the African Union's most recent negotiated price per dose for a shipment of Pfizer vaccines at $6.52. And on the right, we see the estimated cost of production for these vaccines, just $1.20 a dose. If legally able to, countries in the African Union could produce their own vaccines for more than 5 times cheaper than they're currently paying. The pandemic will not end until every nation can afford to vaccinate their people. Here's what we can do. We should temporarily lift patent restrictions on proprietary COVID-19 vaccines from Pfizer and Moderna. And additionally, we should ensure the efficient transfer of these vaccine formulas and technology to members of lower income countries. You have the ability to stop the preventable loss of life. The time to act is now.